So we know that in the mouth, there are several bacteria that are connected with heart disease and heart attacks. However, there are a few main ones that we need to be most concerned about. These include AA and PG. What we know is that these bacteria increase and accelerate inflammation in the blood vessels of the heart. They increase the stickiness of the blood vessels of the heart, which means that more plaque is likely to accumulate, and they actually start to break down the blood vessels and make them more permeable and prone to ripping. Another bacteria that a lot of people don't associate with heart issues is Streptococcus mutans, which is the bacteria most commonly associated with cavities. So even though this is a cavity-causing bacteria and it's not present in the gums, it still will translocate through leaky gums via MMP8, which we've talked about, and go straight to the heart. Now, this bacteria is responsible for 50% of all infective endocarditis cases. And what infective endocarditis is actually going to be inflammation and an infection on the inner lining of the heart. Now, this is really important because if a patient gets inflammation on the inside lining of the heart, they will actually form little vegetations that can deposit on the heart valves. This can damage the heart valves and create holes in them, and it can actually spread to the blood vessels and go to the outside of the heart. So this is something that we definitely want to avoid. So just because you don't suffer from gum disease doesn't mean that you couldn't be at risk for a heart condition if you have cavities. And then for women, this is completely different. And because of this, most women, their heart attacks actually go undiagnosed. And this is very scary because a lot of women actually die from heart disease. It's the number one killer in women. And so things to look out for heart attacks in women are going to be things like nausea. Oftentimes women will have nausea for, several hours, half a day, and they can't really pinpoint it, and it's their heart. They'll have pain in their shoulder, dizziness. They'll also get pain in their jaw. I had a patient that kept coming to me actually in my dental practice complaining of TMJ pain in her jaw. And she had dentures and we didn't quite know what was happening. And after about the third day of her coming back to me saying, my jaw hurts, my jaw hurts, my jaw hurts, it dawned on me of let's check the heart because she definitely had high blood pressure. And sure enough, she was in the middle of kind of a long prolonged heart attack. So really grateful that I knew that information. Another very common symptom of heart attack, especially for women, is going to be back pain. So a lot of times women will have pain in their mid to upper back, especially shifted over to the left-hand side. And that can be a symptom of a heart attack as well. So if you're having any kind of pain in your heart, stomach pain or nausea, upper back pain, left shoulder pain or jaw pain, you can't quite figure out where it's coming from, and you haven't had your heart checked in a while, I would definitely encourage you to go see your provider to get a full cardiac workup.